Thank you for joining, everyone. I would like to introduce Angela Conover, Director of Opioid Response and Prevention Outreach for the Partnership. Angela?
Good afternoon, everyone. Thank you for joining us for today's Knock Out Opioid Abuse webinar, The Perfect Storm, the Impact of COVID-19 on Addiction. Today's webinar is brought to you by the Partnership for a Drug-Free New Jersey and the Horizon Foundation for New Jersey. This webinar is being held in collaboration with NJ Cares and the New Jersey Office of the Attorney General, who we thank for their partnership, support, and collaboration on today's learning activity. Horizon Blue Cross Blue Shield of New Jersey, through its philanthropic arm, the Horizon Foundation for New Jersey, has been collaborating with PDFNJ on a 2-year Knock Out Opioid Abuse initiative to address the opiate epidemic through community outreach, prescriber education, parent education, and a statewide awareness campaign. In light of the current pandemic, the initiative has expanded its offerings to include this webinar series to help continue the conversation about the opiate and addiction crisis as we navigate through this difficult time. This webinar is the first of a 4-part series in collaboration with the New Jersey Office of the Attorney General and NJ Cares, addressing the addiction crisis in our state and how it has been impacted by the COVID-19 pandemic. To kick off this collaborative series, I am now pleased to welcome Attorney General Gurbir Grewal, who has made addressing the opiate crisis and addiction a top priority of his office, and who has been a great support to the Knock Out Opioid Abuse initiative through the years. Welcome, Attorney General, and thank you for joining us today.
Well, thank you, Angela, and good afternoon, everyone. Thank you especially to the Partnership for a Drug-Free New Jersey for hosting this event and for partnering with NJ Cares to put on this series of virtual town halls. Our partnership is an important one, and I think this town hall is necessary now more than ever. This goes without saying that we are living in an unprecedented time. In the midst of a global pandemic, we are living through an inflection point when it comes to policing reform and criminal justice reform. We are seeing wide-scale protests in response to the brutal murder of a black man by a white law enforcement officer. We are seeing those protests talk about police brutality and other important issues, all in the midst of this pandemic while we're experiencing historic unemployment and economic uncertainty. These times are difficult for all of us, and we know that it can be even more difficult for those with opioid use or substance use disorders. The pandemic has made things particularly difficult for those suffering from opioid use or substance use disorders. People are required to shelter at home. The same social distancing that is helping us push back against this pandemic is making it more difficult for some to access their support systems. At first, and this remains an ongoing issue to some extent, individuals also had trouble accessing needed treatment and services. It's difficult in times like these to remain hopeful, but we must. And we must make sure that people, especially those suffering with substance abuse and opioid use disorder, know that help remains available and that they are not alone. The Office of Attorney General and NJ Cares have taken a number of steps to make sure that people have access to needed services at this difficult time. I'll go through some of them, but the work continues. First and foremost, we've compiled a list of substance use disorder mental health resources that remain open and available during the COVID-19 pandemic. This resource list is available on the NJ Cares website and is constantly being updated. Second, we've continued our work through Operation Helping Hand, a program that I started while serving as Bergen County prosecutor. As many of you know, it's a program which uses law enforcement to connect low-level offenders with substance abuse disorder to treatment or to recovery services. Despite the pandemic, this program continues to operate as it must in counties across our state. I'm so heartened to see that those operating these programs have gotten creative. Law enforcement officers and prosecutors have been figuring out new and creative ways to reach people who need help. They've done this by maintaining contact with program participants from the past or responding to new clients who need help by telephone. They're operating 24/7 hotlines where a recovery coach is always available to provide support and link people to care. Atlantic County, Bergen County, Burlington County, Cape May County, Camden, Cumberland, Gloucester, Mercer, Middlesex, Monmouth, Morris, Ocean, Passaic, Salem, Union, and Warren have 24/7 hotlines. Even in the midst of a pandemic, we have made so much progress as a state when we have law enforcement out there on the forefront trying to connect people with treatment all across our state, even now. Others are hosting virtual events like this one. For example, Cumberland County Prosecutor Jennifer Webb McCrae started a Facebook series called Coping with COVID. I encourage you to go watch the episodes that are on their Facebook page. 2 episodes focus on substance use and recovery. And the Morris County Prosecutor's Office recently hosted a screening of a movie about addiction and treatment and followed it with a question and answer with a panel of members from the recovery community. And others are using Operation Helping Hand funds to purchase needed laptops and cell phones so that individuals in recovery can attend virtual or telephonic treatment sessions. That is so incredibly heartening to see where we have come as a law enforcement community when it comes to helping those suffering from the disease of addiction. We've also expanded access to naloxone. My Division of Consumer Affairs recently issued an administrative order which requires practitioners to co-prescribe naloxone when continuously prescribing opioids for chronic pain if the patient has 1 or more prescriptions totaling 90 morphine milligram equivalents or more per day, or is concurrently obtaining an opioid and benzodiazepine. And we are working with DHS, with our Department of Human Services and the New Jersey Harm Reduction Coalition to distribute naloxone to social service providers who work with people experiencing homelessness and people who have recently been released from jail. We've also increased access to telehealth and telemedicine. We've expanded the number of providers engaged in these disciplines. And we've made it easier to engage in telehealth and telemedicine by waiving applicable laws and regulations during the pandemic that previously required providers to use specific technological parameters and devices to deliver these services. Additionally, as you will hear today, the New Jersey State Police and the Office of Drug Monitoring and Analysis continue to analyze the drug environment and share relevant information with law enforcement and health partners across our state. That's just some of the work that our office is doing in this particular moment, along with our law enforcement partners. And we'll continue working and finding new creative solutions because we know that these types of services and programs are needed now more than ever. But we aren't the only ones engaged in this work. People across the state, like this organization and so many others, are engaged in work to ensure that individuals with opioid abuse and substance abuse disorder maintain that needed access to support and treatment. And that's why programs like this one are so important, because they bring together people from all different fields and backgrounds, representatives from the Drug Monitoring Initiative, the National Council on Alcoholism and Drug Dependence, and the Mental Health Association in New Jersey to discuss such important issues, brainstorm about possible solutions, make connections, and think critically about how we can continue to provide desperately needed recovery and treatment services in the midst of a pandemic. I am so thankful to be part of this town hall. Through getting together in this virtual setting, I think we might be physically distanced, but we're showing that we can still remain socially connected and connect people to treatment and services. I'm so heartened to see that there are 500 plus people registered for this program. In an earlier time, in an earlier day, even well before this pandemic, to get 500 people from the community across the state to talk about this issue would have been so difficult. But at a time like this, for us to come together in an environment like this to talk about solutions, that is so incredibly heartening. So I want to thank you again for having me. I look forward to continuing our conversations and our collaborative efforts as we try to address this critically important issue and try to help people who are suffering across the state of New Jersey. Again, thank you for having me this afternoon.
Thank you again, Attorney General Graywall, for your participation today, for your participation at past Knock Out Opioid Abuse Day events, at different town halls that we've had across the state, and just really for your commitment to saving lives in New Jersey. So thank you again.
Thank you, Angela.
Now to deliver some opening remarks on behalf of Horizon Blue Cross Blue Shield of New Jersey, I'd like to introduce Jonathan Pearson, the Executive Director of the Horizon Foundation for New Jersey.
Hi, good afternoon, everyone. Thanks, Angela. First and foremost, I hope everyone and their families are doing well during the pandemic and challenging times, as Attorney General alluded to a minute ago. It's an honor for me to join you here today, and thank you for your participation. I also echo, 500 plus participants on today's call is terrific. A special thank you to the Attorney General Grewal for taking time out of his schedule, especially during these challenging times. We're certainly appreciative for his perspective and insights as he described. And we also really enjoy his continued support, as Angelo mentioned, around the Knock Out Opioid Abuse Initiative for many years. Horizon Blue Cross Blue Shield New Jersey is extremely proud of our collaboration and our long-standing relationship with the Partnership for a Drug-Free New Jersey. And we're pleased to provide this opportunity today to come together during our webinar. The Knock Out Opioid Abuse Initiative is part of our company-wide response to address substance abuse disorder and opiate addiction. And through the Horizon Foundation for New Jersey, our company's philanthropic arm, we have granted more than $1.4 million to combat this issue, focusing on reducing stigma, prevention, education, and assisting all residents in our 3.5 million members throughout New Jersey. And as we know, because of COVID-19, the partnership had to postpone our in-person town hall events until further notice. Today's event, our webinar, brings us all together, connects us digitally, so we can continue our conversation and our community engagement efforts. The partnership has planned a series of these webinars centered on how COVID-19 will impact the opioid crisis. And today's webinar, The Perfect Storm, is the next installment of this series. So in closing, again, I want to thank the Attorney General, as well as Jason, Jamie, Heather, for being part of our panel and the organizations you represent. I also want to thank Angelo, Angela, Matt, and the entire staff at the partnership for all of their great work. And in addition, Jennifer Gowdy from my team, who helps put all of these activities together. We know these events make a positive difference on people's lives. So again, thank you for your time today. We look forward to a great session. Back to you, Angela.
Thank you, Jonathan. And thank you for your support as well, and for the support of Horizon Blue Cross Blue Shield of New Jersey and the Horizon Nations team. Without you guys making this available, it would not be as easy to address the opiate addiction crisis in our state. So today we have a varied and expert panel of featured speakers to address the topic, the perfect storm, the impact of COVID-19 on addiction. Our first speaker is going to be Lieutenant Jason Petrowski from the Drug Monitoring Initiative from New Jersey State Police. He'll be followed by Heather Ogden, the Advocacy Coordinator from NCADD New Jersey, and Jamie Angelini, the Director of Consumer Services from Mental Health Association in New Jersey. So I welcome all of our panelists, and I thank you for participating with us today. Lieutenant Petrowski, I'll now turn things over to you to begin.
Good afternoon. I am Lieutenant Jason Pietrowski of the New Jersey State Police Drug Monitoring Initiative. Retired Major Juan Colon began investigating drug-related implications during the early stages of the epidemic and officially created the DMI during 2013. The DMI takes a comprehensive approach to mitigating community drug harms. Traditionally, law enforcement focuses primarily on supply mitigation through arrests and drug seizures. And while it's important to identify bad batches that are taking lives and shut down those sources, we have turned much of our focus to demand reduction efforts through supporting trainings and education and awareness through monthly webinars and in-person trainings, pre-COVID that is, sharing data and information with our partners and other drug environment stakeholders, including the Office of the Attorney General, NJ Cares, the New Jersey Department of Health, the Department of Human Services, medical schools, hospital systems, school drug prevention programs, and treatment recovery professionals, and many, many others. In a moment, I'm going to give a data-centric presentation, which represents what we know about the drug environment today here in New Jersey, so that we can all understand better what we are up against, specifically related to COVID. But I'd be remiss if I didn't stress that it is not lost upon myself or or my small team here at the NJSP, that when we talk about these numbers and statistics, we are often talking about people, loved ones, family members, and friends who are suffering through substance use disorder. Please understand as I go through our statistics that we do not present this data lightly. You can move to the first slide, please. This is showing the historic, and really just over the last 4 years of the drug-related deaths in New Jersey by county. And the toll taken on the New Jersey communities due to the opioid epidemic has been severe. Information received from the state chief medical examiner, Dr. Falzone, indicates a 258% increase in drug-related deaths from 848 during 2010 to 3,021 during 2019. Depicted here, again, is from 2016 to 2019. The most afflicted counties are highlighted in orange and red. And during this time period, from 2016 to 2019, drug-related deaths have increased approximately 36%, from 2,221 to 3,021 in 2019. I will say that there was a slight dip in 2019 from 2018, which is promising. You can go to the next slide, please. These tragic numbers that I just presented and talked about are why this issue is so vitally important. As we stated earlier, we have a comprehensive multidisciplinary approach that intends to understand the scope of the drug problem, understand the presence and prevalence of specific drugs, and how they're impacting communities, and then enhance policies and practices that will help us mitigate these community drug harms. Obviously, we're in the public safety sector, but we're tied at the hip with our public health partners and treatment and prevention as well. We work diligently with our public health and treatment and prevention partners in understanding and mitigating community drug harms and threats, and these relationships have been instrumental in helping us pivot and adjust to this new public health crisis we're facing, specifically COVID. Specifically, we enhanced the multiple sharing platforms that were already in place to focus on COVID-related issues. You can go on to the next slide, please. So now, if we look at the trends leading up into when we were most impacted by COVID, you look at January of 2019 through April of 2019, we were seeing pretty good progress, and we were about essentially 7 suspected drug-related deaths per day. Since that time, there's been a significant increase, and we hit a high water mark, unfortunately, in May of 2020. There were approximately 9.96 drug-related deaths per day. That is the most that we're aware of ever occurring in New Jersey. Now, we're hoping that you can see there in February, March, and April, those numbers dipped a little bit, and they probably shouldn't have. Being in tune with the drug environment as much as we are, I would have expected those numbers to be a little bit higher. So what I'm really hoping for is that was a little bit of a unfortunate rebound effect from dips in March and April due to COVID. And then again, June so far preliminarily, the numbers are down a little bit. So again, I'm really hopeful that the May number, the 9.96 people lost per day, and that total of 309 is just an anomaly. You can go to the next slide, please. So now, who's been most afflicted during this time? It's been really primarily in the southern part of New Jersey. We're looking at Camden. Had a 34% increase, and what this shows really is average numbers by month and moving and comparing to the high water marks that they've seen. So Cape May was very high as well, 33%, Gloucester 31%, and Atlanta 26%. Again, the southern part of the state saw these significant increases. The one thing I will say through our partnerships and our engagement in the drug environment, there's some things that we have seen that can kind of explain this, and we hope that can explain this to some extent. Again, that it's an anomaly. And what I mean by that is we've seen survivors of overdoses and have been interviewed, and they've been talking about how they thought they were using cocaine. And this is something that happens from time to time in the drug environment, where fentanyl is actually being sold as cocaine. The packaging at some of these scenes was consistent with what cocaine packaging would have been, but it also contained fentanyl. So a lot of times when we talk about how dangerous relapsing can be for someone due to a lower tolerance, or people who are recently released from incarceration, they could have a lower tolerance. Now we're talking about people who may not be opioid users at all and essentially have no tolerance and are getting fentanyl class compounds that are just extremely potent, as we all know, and that creates an exceptional hazard. So again, a lot of the evidence in the interviews point to the fact that cocaine users were actually part of this big uptick that we saw in May. You can go to the next slide, please. Naloxone administration, shown on this slide, represent law enforcement, EMS, and paramedic administrations. While this used to be a very good indicator, now there's so much publicly available naloxone, which is a good thing, but it's not tracked by public safety or public health. So it's probably a less accurate barometer than it used to be, even though we are still tracking roughly 40 first responder administrations per day. So, whether it's a law enforcement officer, EMT, or paramedic, they're responding to someone who's overdosed a minimum of 40 times per day on average. And again, that's just unacceptable. You can go on to the next slide, please. This is just going to show you right here. We want to kind of show you obviously what's going on during the COVID period, and there really hasn't been a lot of change of the naloxone administrations. They've maintained relatively the same, and even in the breakdown between LE and EMS, there hasn't been a lot of change during this COVID period, and it was a slight increase compared to last year as well for these first 5 months. It's about a 9% increase when compared to last year. The breakdowns are kind of remaining the same, so I think law enforcement and EMS were both doing everything they normally do during this time, and again, the naloxone stayed the same as well. So you can go on to the next slide, please. Again, we were trying to assess whether or not there were any changes during the COVID period, in reference to naloxone administration, using that, and multiple doses of naloxone given, that remained constant, and how many milligrams given, that remained very constant, and exceptionally constant actually. So there wasn't a lot of change reference to the naloxone in the overdose environment. And you can move forward. So the implications of COVID-19 on the illicit drug market. So this is something we've been tracking since the beginning of COVID, and we saw things changing as a lot of the COVID implications took place, and even in the retail market. So what we were seeing, potential changes in drug packaging, drug content, and drug pricing. So a lot of this stuff comes from overseas that drug suppliers use to package their drugs, and they just wasn't as readily available, whether it was the packaging, whether it was the other compounds being used as filler to mix with the drugs. A lot of stuff wasn't available. And preliminary reporting showed that based on demand, suppliers did raise their prices for the wholesale drugs, and they were essentially capitalizing on COVID-related price gouging in the illicit drug environment. And we've also shown drug suppliers and dealers are resilient, and they have been some stockpiles of drugs, and they found the ability to substitute different fillers and different products and come up with different packaging as well during this time. You can move forward. So here's what the drug environment looks like if we look at the first quarter of 2020. This is a number we've never seen, and I don't want to say it has anything to do with COVID. It's just been a constant increase, as we'll see in some slides that come up. Fentanyl, however, when a law enforcement seizes suspected heroin, and that term's kind of a misnomer at this point. Like suspected heroin, everyone knows it's not suspected heroin at this point. It's just suspected opioids. But we always called it suspected heroin submitted to forensic labs. 87% of the time, there's a fentanyl class compound in there now. Now, understand that started with 2% in the first quarter of 2015. It's up to 87% now, which is just a drastic change, and something we've been tracking and reporting on for years now. But that is the high watermark. Fentanyl-related submissions decreased 18% from the first quarter of 2019, but glassine bags increased. That just indicates that there's a lot of big seizures happening in the first quarter. Heroin, the number of suspected heroin submissions testing positive with no other drugs has steadily declined from 98% in the first quarter of 2015 to 11% in the first quarter of 2020. So what does that mean? It means that obviously it used to be, in this opioid epidemic, we went from pills to heroin to fentanyl, and and that's, you're just seeing heroin going away. It's down to 11%, and again, commensurate with the increases in fentanyl. Naloxone administrations decreased 5% from the fourth quarter of 2019. We talked about that, even though they increased when we compared time frame to time frame. Cocaine, those numbers decreased from the fourth quarter, but there's more to that story, and we'll get into that a little bit later. And methamphetamine, their cases decreased, but the specimens increased significantly. You can go to the next slide, please. So fentanyl environment in New Jersey, again, I referenced this before, 2% in 2015 up to 87% today. And again, just a drastic change. Fentanyl is very prevalent out there right now, and obviously responsible for a lot of overdoses. You can go to the next slide, please. This is the breakdown by county and just showing which counties are most afflicted. You'll see a couple counties there, 100% of their heroin submissions contain fentanyl, but you'll see a lot of 90s and 80s in there as well. Again, it's just so prevalent and so pervasive right now, and so dangerous. You can go on to the next slide. Again, I said I was going to mention this. There's your heroin only, so when people are selling heroin in 2015, 98% of the time it was just heroin. Now that's down to 11%, and again, that's just showing the drug environment as a whole. And again, COVID really didn't change anything here. It's just the trend is staying the same as it was. You can go on to the next slide, please. So the number of submissions increased from 5% from 2018 to 2019, but the glassine bags that forensic labs in the state took in and processed increased 23%. There were 717,000 doses of suspected heroin, and obviously likely containing fentanyl, received by forensic labs last year. That's just a tremendous number of doses that's out there in the drug environment. You can go to the next slide. When I told you there was more to the story, this is what I meant. Cocaine saw significant increases. After years of significant increases, the total number of cases submitted to labs decreased 14% from 18 to 19. So again, it was a good downturn in 18 to 19, but again, significant increases year over year for several years. The top counties that were showing cocaine-related cases were Camden, Essex, Mercer, Monmouth, and Passaic. And specifically, Camden, Essex, and Passaic accounted for 78% of all cocaine-related specimens. Go to the next slide, please. Methamphetamine. Now, this is an even worse story. If you look on the chart there, from 2015 to 2019, we're seeing a 512% increase in cases and a 395% increase in specimens. And those numbers in 2020, they look to be on the increase as well. Methamphetamine is something that primarily in New Jersey we're seeing in South Jersey as well. You're seeing it in Atlantic, Camden, Cumberland counties are generally the most afflicted. Gloucester there is showing highly afflicted as well. And you can go to the next slide. This is one that's that we look at as well from the forensic labs. And again, we often see oxycodone, especially during this epidemic, and alprazolam, but something that is obviously very dangerous is you're seeing a lot of fentanyl pills, methamphetamine pills. During the first quarter of 2020, law enforcement seized 2,328 pills testing positive for fentanyl. Why is that so important? It's so important because they're usually packaged and sold as an oxycodone or a Percocet, something that has a very low morphine milligram equivalent. And if someone thinks that that's what they're getting and that's what their tolerance is and that's what they're used to, and now they're getting fentanyl instead, which is incredibly significantly more potent than that can be a problem for them. So again, 2,328 pills tested positive for fentanyl or fentanyl analogs, and another 2,000 plus for methamphetamine. You can go on to the next slide, please. So this is, we instituted the Health and Prevention Sharing Network in 2017. The idea behind this call from the our program, the DMI over here in the state police, was to share our data and really the data that you've seen presented before and what we know about the drug environment with our health and prevention and treatment partners out there, so they can be better informed and better interact with people. And it was really a collaboration between us and Human Services and the Governor's Council on Alcoholism and Drug Abuse and New Jersey Prevention Network and a lot of other partners that we all got around and had a dialogue. And again, we monthly, we have these calls and we share this information. Now, the transition and the pivot when COVID hit, this became a COVID-centric call. And really, it was a lot of the same stakeholders that needed to be engaged and we needed to talk to. But we went to a weekly call, and we upped the tempo, and we started bringing in, anyone we could bring in who was a subject matter expert on what was going on, and we were pushing out all the information we had. Again, it's a collaborative call for treatment, prevention, recovery, health, and other partners to discuss relevant topics in an effort to reduce community drug harms, of course. This call series has been redesigned to be specific for this national pandemic and the impact of substance use and mental health disorders. And there's been a lot of great information presented, and I think you might hear a little bit more about that later. But if more information on how to engage with us in this call, if you're interested, you can email dmi@njsp.org. You can go on to the next slide. The general mentioned this as well. I believe this is what he was referring to. We created a resource guide, and the resource guide was specifically related to people suffering from substance use disorder and this pandemic coming. How were they going to get the treatment and the resources that they needed? And it really morphed from there and became a very comprehensive resource guide. We eventually got a request to put it out in Spanish as well, which we did, and there are versions of that on njcares.gov and some of the links you see there. But really, it's just an all-encompassing informational product and a resource guide. So while, again, it started for individuals that were suffering from substance use disorder and how were they going to get their treatment and how do they get to meetings and virtual meetings and things like that, it's really become a resource for anybody. But that's available to the public through those various resources there. And you can go on to the next slide. So that's all I have for you today. And if there's any questions, please send them my way. And I just want to thank everyone for the opportunity to present today. Thank you.
Thank you, Lieutenant. That was really great information. I appreciate you sharing that with us and joining us today. And now I'm going to welcome Heather Ogden from NCADD New Jersey. Heather.
Thank you, Angela. I'd like to say thank you to the partnership and Horizon and NJ Cares, and also the Attorney General for having me here today. It's an honor to be here to talk about this very important topic. Okay, you can go to the next slide, Angela. Thank you. So I'm here to talk about specifically how COVID-19 impacted those people with substance use disorder and the assistance that they could find for it. So the Attorney General actually mentioned this in the beginning. When we first started the DMI calls 3 months ago, we had a really large impact on treatment accessibility. So all of the treatment providers were trying their best to adapt to COVID-19 and how they could still assist people and protect people at the same time, just like everybody else was. It was the same in all business sectors, and treatment and recovery were in that as well. So they wanted to protect their existing clients, but they still needed to help people. So they did a really good job of scrambling and trying to figure out how to accomplish that. And but the fallout of it is that we started seeing wait times for treatment again, which we actually haven't seen extensive wait times in a very long time. So in the past few years, we've made a lot of progress. and we've been able to get people into treatment in less than a few days usually. And we were back to seeing 3 to 4 week waiting periods. This was back in March at the beginning of COVID-19. Initial engagements for recovery supports were hugely impacted. So we have peer specialists or recovery coaches in a lot of different settings now. And again, the providers and the coaches were unsure of which direction to go because of COVID-19. We kind of saw this statewide in all sectors. The amazing thing about this industry and people in recovery in general is that there's a lot of quick thinkers and a lot of outside the box thinkers. So a lot of people made the jump to a digital platform or a telephonic platform very, very quickly to try and keep that up. But it still hit the initial engagement process. So if somebody was not already plugged into some kind of supports or treatment, we did see a hit in people being able to get plugged into that system. Most of you know that we have a lot of opioid overdose recovery programs in emergency departments now, they're a fantastic program, and they help with that initial engagement process. If people are revived from an overdose and they go to the emergency room, they can meet with a peer specialist and they can get connected to whatever the most appropriate type of support is for them. Some of the ORPs had to go digital. Obviously, our hospitals were hitting capacity. The space was needed in the emergency room. Depending on the hospital system and the service provider, different solutions were worked out, but a lot of them went to telephone services as well. Recovery centers had to be closed, and support meetings, in-person support meetings had to be closed. Again, a lot of people made the jump to Zoom meetings or telephone supports very quickly, which is great, but it's not exactly the same. Social service buildings obviously had to be closed as well, and there's a huge crossover in the substance use disorder population and the need to utilize different types of social services. So especially when it comes to insurance. So a lot of people, we know that we're in an economic crisis right now. A lot of people lost their jobs, which also means they lost their health insurance benefits. So people may have had to apply for Medicaid. They would not have been able to do that in person. And any of the other supports that were there, they would not have been able to apply for that in person as well. In the beginning, in the first month or so, we saw a lot of problems regarding PPEs. In addition to, obviously, there was a shortage in the hospital, so there was going to be a shortage everywhere else. But it was a huge concern within treatment, inpatient, outpatient, medication-assisted treatment. Anybody that came in contact with clients put both the staff and the clients at risk for exposure. So there was a lot of effort on the ground to try and get PPE or at least some kind of protective gear to the staff and the clients as well. And then there's the actual atmosphere. So fears over health, your economic status, there's been a lot of strife, there's a lot of instability from COVID and everything else that has been going on with all the uncertainty, not knowing, are we open, are we closed, how long will we have the stay-at-home order in place? Just that uncertainty, it adds to everyone's stress. People often will turn to less than healthy coping mechanisms. So this is normal for a lot of people that don't have a substance use disorder, but what could happen is people that may have had the beginnings of a substance use disorder that had not been diagnosed, it may have had the opportunity to fully bloom during all of this isolation and all of this stay at home. Next slide, please. So because of all of those things that happened, these are a few of the things that we have seen as a result. We saw in the statistics that the overdose rate is absolutely going up. And I certainly do hope that it is an anomaly, and I hope that we see them go back down. But there's no denying that the rates have definitely climbed during COVID. Suicide rates are also going up. We did see that alcohol sales increased dramatically during stay-at-home orders. This was a nationwide trend. In some states, the alcohol sales went up as much as 55%. And so there's a lot of people who have had more time. While they're working from home, or their work may have been shortened, or they may have lost their jobs. A lot of people are using alcohol more. And though this is an opioid town hall, it bears mention that substance use disorder crosses all different substances. We saw that also in the other drug slides with the rise of cocaine and methamphetamine again. Alcohol, though it's legal, still is more deadly to more people than a lot of the other drugs that we talk about right now. But because it is legal and it's also socially acceptable, not a lot of people talk about it. The concern is that people may have gone into quarantine without an alcohol problem, but may have developed an alcohol problem during quarantine. We've noticed that, again, statistics from the DMI, that EMS overdose reversals for a while, March, and it was mostly March, and maybe the beginning of April, there was a decrease in the number of overdose reversal people that were willing to go to the emergency room. So there was a lot of fear of people having to go to the hospital and contracting COVID. So what that did was it lessened people's chances for getting connected to appropriate services. Because if they had have gone into the hospital, they may have been able to meet with somebody who could plug them into treatment and recovery. So months of isolation, anxiety, fear, they build up. People, if they're not adept at expressing emotions, or if they're not even sure that these are the emotions that they're feeling because of these things, it can be, we've seen domestic violence rates go up. We've seen there are rumors that there are lots of family issues now because everybody's been locked down. These are obviously things that we're not going to see hard and fast statistics on until later in the day. But I think all of us that have been living through this, especially in New Jersey, where we've kind of been the epicenter of COVID, us in New York, we can see that people are, they can be snappier with each other, and they can misdirect it and direct it towards their loved ones instead of being able to plug into what they are feeling and figure out a way to deal with it. So again, there can be a lot of anger. There can be use of substances to deal with all of those anxieties. So these are all things that we are watching unfold in real time, but unfortunately, data doesn't come until later. The biggest issue is that both substance use disorder and mental health thrive in isolation. They are, those of us that work in the field say they are diseases of isolation. I'm a woman in long-term recovery from both substance use disorder and mental health, and I can tell you that it's connection in various forms, because there's lots of different ways to do this, but connection is what helps you get to the next stage. It's what helps you develop in recovery. So people that have had to be isolated, we've all had to have this social distance, a lot of these things have flourished. We've also seen there's been a lot of press about the impact that this is going to have on our essential workforce. So there's been a lot of talk about nurses and doctors, but there's a lot of other people that are considered essential workers that are going to have some kind of reaction that may not present itself for a while due to what they witnessed during COVID-19. There are other people that work in hospitals. There's people that clean and work in the cafeteria, and people that have had to work in grocery stores. The fear and anxiety of their clients, sometimes comes out on them. So we're going to see some fallout of this It could present as substance use, it could present as mental health issues, or both. And also, obviously, the extremely high rate of people that are now unemployed, that's going to have not just economic fallout, but an awful lot of mental health and substance use fallout as well. Next slide, please. So looking ahead, we're already kind of seeing it. So we've been calling this the perfect storm for several months now because we could see it coming and all of these elements were coming together, but we're kind of in the beginning of the storm now. So if you look at data for previous disasters like Hurricane Katrina or September 11th, they show that substance use disorder and mental health issues rise exponentially in the months following after the disasters happen. They tend to, people tend to not realize it's actually an issue until a good 6 months after the crisis, the initial crisis has passed. So once we are on the other side of COVID, whatever that looks like, we can assume that in about 6 months, there's going to be a surge in demand for both substance use disorder and mental health treatment or recovery options. There's a lot of data to show that depression, PTSD, anxiety all rise. Substance use does rise as well. So it may peak, not peak, but it may come to a head about 6 months from now. So people will say, oh, I'll be okay, I'll be okay. 6 months from now, they realize they're not okay. And that will continue to grow for, it's a question mark on the time, but at least a year and sometimes 2 years following it. They don't track the data as well long-term on those kinds of things. But I think most of us, again, because we live in New Jersey, a lot of us had loved ones or ourselves were involved in September 11th or had friends that got through Hurricane Katrina, and some of the fallout from the trauma that people had from those crises really didn't come to light for a very long time afterwards. So I think that we're going to be seeing quite a fallout for some time as a result of all of these things that happened during COVID. And that's even without contracting COVID itself, just all of the economic and financial and social issues that happen to people will have some kind of results down the road. Our biggest concern is that the demand is going to be much greater than our supply. In the pre-COVID world, we were already very limited in New Jersey, especially for people with Medicaid or that needed state funding to go to treatment, specifically for SUD or mental health. There just were not enough beds. Now we have a huge number of unemployed people that have lost their insurance. So if they do need treatment or assistance with either of these things, they're going to need to go to a Medicaid or a state-funded place. So we're very concerned about the capacity to deal with that. Obviously, the budget crisis that we are staring at in New Jersey, we're very concerned that out of necessity, it's going to cut supports or cut back on supports. It might eliminate some programs at a time when more people than ever need it. So we're very worried about that. That is something that we really need to take a look at because assistance for people's wellness, recovery and wellness is going to be absolutely crucial in getting back on our feet after COVID. So it's one of the last places we should look at for cutting funding, but there is the fear that that might happen. Next slide, please. So what can be done about it? This is actually a tough question, and I'm an advocacy coordinator, so I wish I had a really great response for a magic wand that would fix it, but there's a lot of different things that people can do to kind of chip away at this. The biggest one is to contact your local decision makers and your elected officials and tell them that we need to keep this funding for substance use disorder and mental health for all of the reasons that are being spelled out in this webinar. Advocate that some of the funding be used for social supports and services and treatment instead of punishment. We use a lot of funding to put low-level offenders into county jails and prisons. We could be using that funding instead of for punishment. We could be using it to assist people. Expect that people are going to react to stress in different ways. We may see a spike in the crime rate. We may see some of the things that have lessened over the years. We may see a spike in some of those things again, but sometimes it's just a reaction. We can't always expect people that are in the throes of an addiction that they need help with or in the throes of a mental health episode. They deserve assistance no matter how it manifests. We need to offer more support and more assistance that is appropriate for each individual than what we currently have. Seek out existing resources for you and your employees right now. So you may feel fine. You may think that this is not going to affect you. I can tell you that I think this is going to affect all of us. It already has. This has been a stressful time. It's been an anxious time. It's full of uncertainty. I'm not saying that everybody will need help, but it's not a bad idea to already have resources at your disposal for you, for your family, if you have employees, for them. If you do oversee employees, create a workspace where people feel safe to talk about these things. By walking around and insisting everything is fine and, we just want to get back to normal, I think normal as we know it is going to be very different. So if you have the ability to do it, have some supports on site, have resources available, and just going forward for yourself, for people with substance use disorder and mental health issues, your loved ones, your coworkers, everybody around you, we need to expect normal to be different. Like we've moved the benchmark from normal. So we need to give ourselves and others, we need to give that space to adjust to all of these things. Life is different now in the, I can't even say after COVID space, we're still in the COVID space. But things are going to look different. And I hope that of some of the things that this wasn't all bad. I mean, COVID is a crisis unlike anything I've ever seen before. We've watched all of these things change in a very short amount of time. But there's been some good that has come out of it. I think that people do feel okay expressing things that they've never expressed before. We have learned that some of the guidelines and rules that were overseeing certain types of treatment, especially around the medication, that some of these rules are arbitrary and our fears surrounding them really don't apply. Out of necessity, in order to adhere to social distancing, SAMHSA loosened the guidelines on methadone prescribing and started allowing people to take home 14 to 28 days of medication. Buprenorphine, which a lot of people refer to by its trade name, which is Suboxone. They lessened the restrictions for that. First, it was telehealth, which means that it was a video capacity, and then people realized that a lot of people don't have video capacity, so they allowed telehealth, telephone prescriptions rather. So we've made these things more accessible. So this is a positive thing to come out of a space that we would not have expected these things to come out of. We've also seen that the gaps in our continuum of care, they've been highlighted. So those of us that know the field and work in the field, we've seen the gaps in it, but regular people, loved ones with substance use disorder, people that aren't plugged into the recovery and treatment system, they've seen that there are these gaps, and partnerships have grown up around filling those gaps. This town hall is another example of that. The DMI calls were a wonderful example of that, of bringing together different stakeholders to try and work on solutions. So hopefully looking forward, though we've learned a lot of things that we have seen a lot of things that we would have hoped we wouldn't have had to see. COVID was something that I don't think any of us saw coming. But I'd like to try and look at some of the benefits of it, and I'm hoping that we can start looking at solutions for substance use disorder and mental health in a different way because of the situation that we have been in. So thank you very much. Back to you, Angela.
Great. Thank you, Heather. Thanks. That was really life-saving information, I think really important to this conversation. I just want to mention before we go into our final panelists that if you have any questions, please enter them using the chat feature. Once Jamie has finished her presentation, we will ask the questions that you have submitted to our panelists. And we may go a bit time, and if we do, we'll still take those questions after time. Our panelists will stay on the line, and I hope that you can join us for that question and answer as well. And so now I welcome our final panelist for the day, Jamie Angelini from the Mental Health Association in New Jersey. Hi, Jamie. Welcome. Hey, Jamie. I'm not sure if you're having an issue with your sound.
How about
now?
We're
not hearing you. Oh, we can hear you now.
Okay,
welcome.
Thanks.
Thank you.
Next slide, please. Thank you. So again, thank you so much for having me, and thank you to Heather for kind of leading us into this conversation around mental health and the importance of it. So really talking about COVID-19 and mental health, and if we can go to the next slide, I'll show you some of the objectives I hope to get through today. Really looking at the impact of this pandemic and what it's had on our mental health. I do think Heather really talked about it. It's a little too early to even know what the impact will be. But I want us to really think about the importance of nurturing our emotional health during COVID, and not just for ourselves, but the people in our community and the people we serve as professionals, and then tips and resources for maintaining wellness. Next slide, please. So here's what we know. We know that everyone experiences stress in response to a situation that can be perceived as uncertain or threatening. And I think we can all agree that COVID has presented itself in a way that does feel threatening and does feel uncertain. For the general public, the mental health effects are as essential as the physical health effects. And for the 1 in 5 who already live with a mental health challenge, it's really up to all of us to take, kind of that personal and professional measure to address that now. And think about that number, 1 in 5, and that's pre-COVID. So even if there's, 500 people on this call, 100 of us could be impacted with a mental health challenge in our lifetime. We know for many, having to unexpectedly leave or disengage from our community, even for a short time, has been extremely stressful. We also know this pandemic has exacerbated symptoms for individuals who were already experiencing anxiety or depression or another mental health issue. Next slide. So the outbreak of COVID-19 or any infectious disease can include many different fears and worries about our health, the health of our loved ones. And we also want to think about changes in things like our sleep, our eating patterns, concentrating, worsening of chronic health problems that we've already had. Again, worsening of chronic mental health conditions that we were already living with. And again, today we talked a lot about the increased use of substances. So as we move through today, we move through these slides, really thinking about ourselves, the people close to us, and if we're noticing some of these early signs and symptoms, how we now figure out, when we ask for help, how to nurture our emotional health, because again, we're not sure what the long-term impact will be of our emotional health as per COVID. Next slide, please. So here's what we need to consider when we're thinking about mental health and a disaster. And we are referring to COVID as a disaster. The way we would, a hurricane, a flood, a fire, even though we know this is very different, we're looking at it as a disaster. And the things that we should consider are the sudden and rapid loss of life that we've experienced as a community, the massive job losses compounded by that increased social isolation, and the other panelists have talked about that today too. The near constant stream of news and media is something that we need to consider around our mental health. Thinking about the people who were already getting help. So for those in our community who had supports in place and that has been interrupted, you know, as a mental health agency, we were able to quickly move all of our services telephonically and virtually. But like Heather had mentioned, it still doesn't feel the same, and there still has been some interruption. So thinking about that for folks. And for those whose sense of well-being has been severely impacted by the concerns. So when we think about the impact and the long-term impact, you know, these are just a few of the things that we need to consider, kind of the tip of the iceberg there. Next slide, please. So as we think about ourselves, I want everyone on the call to really think about their emotional health and think about how they're doing and when it's time to reach out for help or support. I'm going to just read some of these, and I want you to really just take some stock for a moment. But if you think about since COVID, if you're having difficulty carrying out your daily activities and responsibilities, if your relationships and your friendships are beginning to suffer, if you've lost interest in social activities. So for many of us, we're not able to take part in the things we did, but if you've actually lost interest in those, we kind of see that as a sign that maybe you're not, not feeling so well, maybe a little extra support would be helpful. Loss of enjoyment in the things you typically did before COVID, purposefully wanting to isolate. So again, not because we have to for safety, but just that feeling of, I want to isolate, I want to withdraw. And then the last two are extremely significant. If we or someone close to us is having thoughts of suicide, thoughts of death, feelings of despair, hopelessness, or helplessness, we absolutely want to reach out for help ourselves or make sure we're getting support and help for that person close to us, whether it's a family, friend, or someone we serve professionally. We know that mental health challenges are extremely treatable and should not be left untreated. And we know that even though we've been through something stressful, we shouldn't put it to the back burner. If we're starting to experience some of these early signs and symptoms, I ask you to, please reach out for some support. You might say, well, how do I know? How would I know I'm looking at this, and is it time to get some help? One of the things I like to share is kind of this really quick resource. It's a screening tool. It's one of the easiest ways to determine whether you're experiencing symptoms of a mental health condition. Next slide, please. So this is just an example, and these screenings are available at Mental Health America. They're really wonderful because it's a way to take stock in ourselves or someone who we might be concerned about around mental health and go through a series of questions. You fill it out online anonymously, confidentially. You can do it on your phone or your computer, and it will give you a score at the end. So it's a nice way to think about, hey, you know what, over the last 2 weeks, how have I been feeling? And thinking about your answers. And this is one screening I just wanted to show you. We're not going to go through it all and, thinking about the time restraints we have today. But you can find this online. There's depression screenings. There's bipolar screenings. There's one that parents can take. So for those of us like myself who are parents who might be concerned about the mental health of their teen or their young one, you can actually take a screening to think about how they've been doing. So again, as we talk about nurturing our emotional health, I wanted to make sure you had some really concrete resources today. Next slide, please. So thinking about tips for maintaining wellness, because if we're recognizing that there's an impact around mental health in ourselves or someone close to us, thinking about what can we do? So some nice reminders, for one, we know that these strong feelings may fade over time. But if they don't, we should probably ask for some support. If you or someone close to you was utilizing professional treatment or support before the pandemic, continue that treatment. We know that telehealth is now more widely available, but also many recovery groups are online. So that could be something that individuals can use. And then I think Heather really talked about this importance of connectiveness. And I can't say it enough, making sure that we as a community are connecting with people, family, friends, even just individuals who can validate that, hey, this is really difficult what we've gone through. This has been 2 or 3 months of a really difficult time, and being able to connect with people whether it's around COVID or around something else, but that feeling of connectiveness when it comes to mental health is so important. Next slide, please. So again, seek help if needed. I can't say it enough. If you're having feelings of, or different behaviors where you're just not, functioning, for lack of a better word, typically, and you're having difficulty with your normal daily responsibilities, it might be time to just ask for support, ask for help. And that can look a lot of different ways. And if you can't find a provider, there's so many options. I'm going to leave you with some resources today that if you are looking for support or someone close to you is, help really is just a phone call away. And I want to make sure that I stress that. Next slide, please. So here are some coping reminders. Some of you may have seen these before. You may have heard these on other webinars, but they're so important. And when we think about what we have been through, this has been like nothing else in our community. So when we talk again about connecting with others, and social distancing does not have to be social isolation. We know that positive social support is a protective factor. It's a proven protective factor for emotional health. Ensuring that we're taking part in some sense of routine. And that could be a new routine. That could be that, hey, you know what? A month ago I was doing this and now I'm creating a new habit or establishing something new. But just that feeling of structure for so many of us around our good emotional health has been really important. The next one talks about honoring your feelings, knowing that everyone reacts differently to a disaster. Whatever you need to feel in that moment, go ahead and feel it and be supportive of other people. I kind of say for myself, it's been this emotional roller coaster of, day to day, hour to hour, week to week, and allow yourself to feel that, but also reach out when you need support. And be mindful that coping is very unique for everyone. So our beliefs and values around COVID and the way that we are responding, the way we are keeping ourselves healthy and our family healthy might be very different from your family, from your friends, or even your coworkers. So just being mindful of that around our own mental health. And with that, thinking about, it's been difficult for so many people and everyone's on edge, so trying not to take things personally. And then again, checking in with yourself regularly. So whether that is an online mental health screening or, whether you take a moment to meditate or journal, but being really careful about not letting those feelings go, checking in with yourself, owning and honoring the feelings, and again, reaching out for support if you need it. And if you're noticing that someone close to you is in need of support, offering that to them too. Next slide, please. So some more self-care precautions can never be enough. Focusing on the things we can control. COVID has taken our control away, and I think that's been part of the increased fear and anxiety around our mental health. So for us, it might be something really small that we can focus on. Limiting our exposure to social media and the news, avoid watching it right before bed. Again, these are just tips, do with them what you want, but I have found for me personally, this has been extremely helpful. Engage in meaningful activities, even at a social distance, but something that really feeds our soul and gives us purpose can be helpful. Leaning on our personal beliefs and faith for support. And then acknowledging and appreciating what the people in our community are doing. So really that sense of gratitude. And again, when we think about emotional health, these are just some tips that I wanted to share because I think that they can be supportive and helpful during this difficult time. Next slide, please. So we talk about resilience, and I know a lot of people are talking about resilience during this time. So a couple of things I want you to remember. For one, it is normal to have a reaction to an abnormal event. Many of us are having a reaction, and that's okay. We know that everyone reacts differently to trauma, and the goal of resiliency is really to minimize that long-term impact. So the hope is that we can avoid long-term depression, anxiety, or PTSD if we focus now on nourishing our emotional health. Resiliency is not a trait that we inherit. It's really this combination of actions, thoughts, and behaviors, and it's aimed very specifically for you. So I wanted to kind of, make sure that I left you with that around resilience, that it is very specific, but it is something that hopefully will minimize the impact of this traumatic event that we've been through and are going through continuously. Next slide, please. Here are some self-care resources. I'm not going to go through these. I'm just going to make sure that the slide is shared with you, and I know these slides will be available later, but these are great little tips for apps on your phone or something you can do online. Some of them are around meditation or yoga. There's one at the bottom called Breathe to Relax. That's one that I really like. I love using it for myself or my kids because it is something that even during the workday, you can just step away and take a few minutes on your phone and do some nice breathing exercises to de-stress. So again, this will be made available to you and just some great resources. Next slide, please. I also want to leave you with a call line. So the Mental Health Association, which is the agency I work for, has a call line that operates 7 days a week, 8 to 8. We also have a text line. So this is for immediate emotional support. Please have these numbers with you for yourself, for a friend, for a client. The call line is 866-202-HELP. The text line, you just text NJ HOPE to 51684. And again, you can immediately have ongoing emotional support. You can get linked to a crisis counselor. You can get linked to traditional support. And right now, we are really utilizing this as part of a bigger grant. Next slide, please, and I'll talk about that. So we have a FEMA grant right now. It's called New Jersey Hope and Healing. And it's providing emotional support to anyone impacted, which is all of us really, by COVID-19. So for anyone struggling with stress or anxiety, they can be referred to this program. It is a collaboration with the New Jersey Department of Human Services, Division of Mental Health and Addiction Services, Disaster and Terrorism Branch, and there are a few other providers in the state that are working on this grant. But this is a way that we can reach out to people through this kind of neighbor helps neighbor model, where individuals who are experiencing stress and anxiety related to COVID, maybe for the first time ever, can feel really safe talking to someone who can validate those feelings and talk about things like, how do we manage our emotional and physical stress? You know, how do we reduce negative thoughts, problem solving, doing positive things? So again, this program is completely free. It's available to anyone in New Jersey. Highly recommend that people utilize it, especially for those who are not utilizing services in the traditional mental health service way and really are just looking for something for the first time. There's two more slides if you want to just go through those. And one is just resources, and then I think the last one is just my information. Thank you so much.
Thank you, Jamie, and thank you for sharing all of those resources. I know that one of the questions we've received numerous times throughout this webinar has been, where are resources and some existing resources that we can connect to, so I appreciate you sharing them. Before we get to any questions that we may have, I want to thank all of our panelists for sharing their expertise today. I want to thank Attorney General Graywall, Sharon Joyce, and Catley Levy, and the New Jersey NJ Cares team, and all of our participants for joining this conversation to knock out opioid abuse and address addiction in our communities in our state. Information on the upcoming webinars in collaboration with NJ Cares and the Office of the Attorney General are available, along with resources and a copy and recording of this presentation, and they'll be available on the website knockoutopioidabuse.drugfreenj.org. We'll also be following up with each of you with a list of resources, including resources that are available from NJ Cares that the Attorney General mentioned. And right now there's a brief survey that if you could complete, we'd appreciate your feedback. I want to thank you again for committing to be part of the solution to New Jersey's opioid crisis. And on behalf of Horizon Cross Blue Shield of New Jersey, the New Jersey Office of the Attorney General, NJ Cares, and the Partnership for Drug Free New Jersey, we wish you continued good health. Right now, you'll see a poll is launching in front of you. If you could complete that, we would appreciate it as we go to our questions. I'm going to start with one question, and Jamie and Heather, I think both of you could possibly contribute to this. It concerns mental health. How important do you feel reopening schools is to addressing the mental health in our children, and what supports are there for our children? So Jamie,
Heather,
do you want to start?
Yeah,
okay.
I'll jump in. And I think it's a difficult balance between what feels physically safe for our kids and their emotional wellness. And I do really strongly believe that if the schools cannot open in September the way they're planning to, that I do hope there will be a lot of virtual support in place for the kids, because so much we know of their learning is that social and emotional learning. One of the things that we've been trying to do through our grant is put together some self-care but fun workshops for kids and teens especially, so that they have something to take advantage of virtually around their emotional health. And we're providing things for the parents and the teachers at the same time. It's a difficult question, and as a parent, it's been a difficult struggle for me. Heather, did you want to jump in?
I just want to say I completely agree with what Jamie said. I have children as well, college, high school, and just graduated from elementary school. And I think that they've weathered it a lot better than I think we would have expected. But I know that especially people that work in the field have been hyper vigilant as to any kind of symptoms within our kids. And to answer the question about where we go for resources, my district has been very good about sending out emails with local resources. So if you're not sure where to start, if you need assistance for your children or for yourself, you could always send an email to your local school officials, and they should be able to give you a starting point for that. Or you could reach out to myself or Jamie, and we could send you lists.
All right, great. And we'll make sure your contact information is in the slides that everyone is receiving. Heather, I think this question would probably be best for you in regards to stigma and language. What types of workshops are available to educate and give awareness?
There are, so I kind of specialize in language because I really think that that's the best way to initially alleviate stigma. We don't even realize what kind of implicit bias we have against different groups or different disorders until we actually take a look at the language that we use. So there are several workshops out there. I do some of them, but I'm not the only one who does them. There are several language trainings that will help you look at better ways to address it. So I was thinking in the beginning, it's great to actually hear people using the terms substance use disorder. We're making the transition to that finally. And the word recovery, to hear the Attorney General of New Jersey talking about recovery is just an amazing thing. If you had told me 10 years ago that would happen, I don't think I would have believed it. But if anybody is interested, we have developed several different language trainings now. We started with one that was for people and family members and professionals in recovery, but we've expanded it because there's a high demand for it. I've done them for law enforcement officials within some of the county jails. I've done them for medical professionals, and especially for treatment professionals, because you wouldn't think that would be an issue there, but it is. So if anybody is interested in having a language training, we've developed them for the Zoom platform now as well. I used to come in person, but it'll be a while before I can do that again. So my email is in the slides. So if you're interested in specifics, please reach out to me and I'll get you the information about that.
All right, great. And I know there's a question about the need for sports and the impact sports have on our children's mental health. And I just want to mention that there is a webinar coming up on September 24th. It's actually the last of this series with NJ Cares. And I invite you to participate in that. We'll be addressing that topic specifically. And then we just have one final question, and it's for all of our panelists. What can be done to avoid creating new opioid users or address those with substance use disorder during this time? And Jason, we'll start with you.
I think we need to just continue to focus on prevention and outreach and training. And I think a lot of people have, drug environment stakeholders have stayed the course. Our unit gave a presentation last week and a presentation this week to law enforcement against drugs officers that are going to be in the schools and interacting with the children on what the drug environment awareness is. And normally we would do those presentations in person, obviously, but we transitioned to Zoom briefings now and things like that. So again, we're going to have to find just new and innovative ways to do the outreach and the education and the awareness and to get the word out. And I think we just have to stay the course and find some innovative ways to keep conducting our outreach efforts.
All right, great, thanks. And Heather, do you have anything to contribute to that?
Yes. So prevention is extremely important, especially from families and schools. But for the immediate, I'm a big believer in actually early intervention, because there are people that can safely use various drugs and alcohol and they don't develop a problem with it. It's when people start to see that their life is becoming negatively affected by their use that that is a good time to start introducing connection and recovery services to make sure that they are living the best life possible before it turns into something larger with a lot more negative fallout from a potential addiction. So, if you think that you may have a problem with it where it's negatively affecting your life, there are lots of different options out there now. This is not, it used to be there was only one path to recovery, but there is not. There's lots and lots of different ways to maintain your wellness. So, so reach out to somebody and let them assist you with it.
Great, thanks. And Jamie, we'll close with you.
Yes, I'll echo what they both said already and just add in, prevention, early intervention trainings for the community, not for just professionals, but everyone in the community so they can recognize early signs and symptoms, reduce the stigma, ask about it, and continuing to expand our peer workforce with peer recovery specialists. That's always the hope for me personally.
All right, great. Well, thank you again to all of our panelists. You're all were really great, and I think that the information you shared is so significant during this time, and really, I think there are lessons learned that we can continue to hold on to that can travel with us into the new normal post-COVID. Thank you again. Thank you again to our collaborators, and thank you to all of you who have joined this conversation. I wish you a good afternoon, and be well.